Good morning, everyone. Thank you for joining us today for our Wednesday briefing on COVID-19 and the effects that it is having on our state and the efforts that we are making together to address those impacts. One of the most important, I say thank you because one of the most important things we can do is provide continuous stream of information to Tennesseans. The more they understand and the more they know, the better we all will be equipped to do what it is that we can do to slow the speed of this disease in our state and to lessen the economic impacts that it will have on our neighbors. So thank you for being here. It's been suggested that this entire effort is federally supported, state-led, and locally executed. And I would say that is it's a good synopsis because we are certainly in communication with the federal government. I want to commend our federal delegation that our team has been working with to make sure that efforts from the federal government that are being announced daily are that we're bringing them into the state and making sure that we're utilizing access to funds and programs correctly. And so our state teams are doing a powerful job, I believe, of getting that information, pushing it through the state down to the locals. Today I was on a call with that invited every county mayor and every city mayor in the state to participate in that call, and we talked about just how it is that what's happening in our communities is really where this is being addressed. So we want to keep a clear line of communication open to our counties and to our cities and to our towns all across Tennessee to make sure that we all are addressing this together in the most effective and efficient ways. I want to give a couple of updates and reminders on what we talked about in the last couple of days. Remote assessment sites. We're pleased that remote assessment centers are growing by the day. Visit tn.gov for up-to-date information on those assessment centers. We are grateful for our private sector providers who are bringing these online from one end of the state to the other. There were questions about our state employee workforce and what we're doing to move workers into a safer environment. So Friday we announced 11,400 state workers would be in alternative work system, which means that working remotely from their offices. Today that number is up to 15,000, and we have a plan through our Department of Human Services to place an additional 8,400 employees on alternative workspace solutions. That'll bring 19,000 of our employees. There are a number of Tennessee state employees who can't do their work from home. An example of that might be a TDOT worker. But for those state employees who can't work from home, we're working hard through our Human Services group to employ a safe workspace for them as well. We talked a lot about education and school closures in the last couple of days. Issues around testing have come up. As schools close, the Department of Education is working with the legislature. As we speak, there are legislative initiatives that are being considered that will address the issues of testing and assessment in our state. So our department working with the legislature, and we've also requested federal waivers that will allow us to have flexibility with the conditions that we face. Currently, we expect our schools to be closed for 2 weeks. That's the current plan, but we want to have as much flexibility as we can for whatever comes our way. So there's no answers yet about testing and assessment and waivers around days of school attendance, but those are all in the works, and we should have answers shortly. Today, I want to make the bulk of my comments around small businesses and the efforts that we're doing to give strength and to shore up our small businesses in this state. And then I want to talk a little bit about medical supplies and the challenges that we face with medical supplies going forward. I want to make a comment as well about our budget. So those are going to be the three primary areas we talk about today. I'll first address our state budget. As you know, we have worked in the budget office, and our F&A Commissioner Stuart McWhorter has been working, I will say, tirelessly for days with the budget office to change and adjust our budget to what we believe is appropriate to address the challenges that we may face going forward. And let me just, let me make a comment here that the future of our economy in this state and in the country, it's not certain. We certainly are not, we don't have a clear understanding that we have a great financial crisis that will unfold. We don't know the length of it. We don't know the depth of it. But we do know that in business as well as in state government, just planning ahead for what might come in an economic downturn is a smart thing to do. I've known that for all of my life in business, and now in the role that I'm in, I think it's very important that we in state government prepare for the potential of a serious economic downturn, and that's what we're doing in our budget. So fortunately, we have been fiscally responsible in the last several years, which have allowed us to build up a rainy day fund, reserves in our TANF funds, our temporary assistance for needy family funds, our child care funding, our unemployment insurance state funds. All of those are strong, and they're in a good position because we have prepared for days of economic downturn. Our budget, which was released today, our proposed budget to the legislature, shows a continued effort in strengthening that budget so that if and should the economy have a serious downturn for a prolonged period of time, we'll be ready for it. We have proposed funding for primarily those services that we deem essential and that are already underway in our state. We want to make sure that Tennesseans are served by state government in the way that is appropriate for them to be, and that all of our services continue forward. So funding for that essential services has been put in place, but we've also taken additional funding that was going to be allocated to other initiatives in our original budget. We've taken that funding and put it into reserves. We're making a significant investment in the rainy day fund. We're making a significant investment in a COVID-19 emergency fund. We will continue to fund the BEP so that we have appropriate funding for education. We're appropriately funding TennCare. We'll make additional funds in some of those reserves and in programs that we think will be needed, as like the healthcare safety net for the uninsured, programs that will be needed for those who find themselves in a more difficult position because of what might come in the future. So that budget, I believe, is a very appropriately designed budget to prepare us for the days ahead, and I feel confident that it will be the right approach. The legislature will review that budget, and they'll make recommendations, and then they plan to pass that in the next few days. I want to speak a minute about small business. When I think about a balanced budget, I think about business people. And most of my life I ran a small business, and 95% of the businesses in this state are small businesses. It's the backbone of our economy, and it's something that we have a great deal of concern about going forward. 94% of our private sector is made up of small businesses with fewer than 50 employers. These are, in fact, companies that when economies hit hard, even if it's a short-term hard hit on the economy, it impacts small businesses. We're seeing it happen in our state, all across the state, even today. So today, our administration has completed an important step for small business assistance. We gave our Small Business Administration, which is a federal government department, we approached the SBA with a disaster declaration request that was completed today and has been submitted to the SBA. That will provide for access to funds that will be distributed as loans. They are small business loans to the vast majority of businesses in Tennessee, any business that has been negatively impacted by the COVID-19 disease and the subsequent economic impacts of that to businesses. Any business in the state that's been affected that qualifies as a small business, and that's the vast majority of our companies, can apply for these loans. They're low interest loans up to $2 million in assistance per business. This will be crucial for helping companies endure through the transition period from the beginning of this crisis to a point in which they can stabilize their company and continue to operate and return to profitability. So this SBA loan assistance program is very important for our businesses. I'm proud that we were able to do it, but it's only the first step in what we want to be able to do going forward. Much of the conversations federally around business relief are just that right now. They're conversations. There are bills moving through Congress right now that could significantly impact funding to our state and to small businesses as well. So we'll be working with federal government should those become available to us. I just want to comment that today I spent some time talking with and having conversation with leaders from the Tennessee Chamber, representing businesses all over the state, the National Federation of Independent Businesses, which represents small businesses throughout Tennessee, the head of our Grocers Association, the head of tourism businesses, multiple business leaders that represent or that are in contact with small businesses, and we are working together to create an environment that will be helpful for those businesses and to talk about how they individually can help mitigate the spread of the disease as well. I spoke with the head of the Grocers Association today, and I just want to make a comment about food supply and the food chain. I was assured by the head of the Grocers Association that Tennessee has a very strong and a very stable food supply chain. We are not worried in this state about running out of food supplies. But the one thing that disrupts that food supply chain is panic purchasing. And the head of the Grocers Association encouraged me to encourage Tennesseans to not hoard and to not panic buy and to not respond to things you might hear out there that cause you to panic around grocery supplies. We have a stable and consistent food supply chain in this state, and in fact, grocers are hiring right now because of their need to provide food supplies in a greater degree as people move away from eating out in restaurants. As restaurants comply with our guidance on the numbers of folks that they serve, it means more people are eating at home, and there's a greater need for groceries. And so the supply chain is strong, and grocers, in fact, need workers. I want to make one comment about groceries, and I'm always trying to encourage Tennesseans to think about how they might help their neighbors and how we can together engage in this process. The most vulnerable population in our state are the elderly. The number of people that will likely become seriously ill in this process and lose their lives in this process are the elderly. I've talked about how we Tennesseans can step up and engage in our community and help our neighbors, whether it's helping them with child care, whether it's churches adopting a school and the families in that school who find themselves in hardship. But what I would suggest to you today is think about how you can help the elderly socially distance themselves. The elderly oftentimes find themselves in a situation where they have to go to the grocery store. or they need to get out there and get that food for their pets, or they have to go to the bank to do their banking because there's no one to do that for them. Think about ways, as you think about ways that you can individually do your part to address this spread of this disease, think about the elderly. It's one way that you can step up and not only consider yourself in this situation, but consider others as well. I want to talk a bit about medical supplies. Everyone has heard, and it's been widely reported about how all states are working together to gather medical supplies, and I will tell you that's the truth. I was on a call today with the National Governors Association, governors from all across the country, talking about how it is that we're going to find and source medical supplies, not just for testing. We brought up plenty of testing opportunity in our state, and we have resources for that, but medical supplies are needed to test, and then once testing turns into treatment, medical supplies are needed there as well. So it is the next challenge that we face in this for certain. I've directed the Department of Health to work together with the Department of Military and with TEMA, our Tennessee Emergency Management Agency, to procure medical supplies. Also talked and am working with, and we'll have actually on the stage with me today, Dr. Wendy Long, who represents the Hospital Association. Private providers are challenged with and tasked with procuring medical supplies. There's no easy answer for this, but I can tell you that we have a targeted effort at pursuing those supplies to make sure that we don't have any slowdown in our ability to test and to treat. That is our goal. I will say that we ordered ventilators even today through the Department of Health, and we're aggressively pursuing those supplies. So I want to also, I've spoken to the medical community broadly, and I want to do that again today. Reach out to the broad medical community all across our state in medical facilities that may or may not be engaged in the COVID-19 issue, dental offices, or in any number of medical offices that may have supplies that will be necessary and will be needed for urgent medical care for the sick. To the degree that people can be flexible and can work with the Department of Health to provide information about those supplies, that would be helpful. So we're reaching out to Tennesseans in the medical community to do that as well. I want to invite Dr. Piercy from the Health Department, along with Dr. Dunn, Patrick Sheehan, who is head of our Tennessee Emergency Management Association, Dr. Wendy Long, who is the CEO of the Tennessee Hospital Association, to come to the stage because I want to open this up to questions, and some of those questions may be directed there. So we'll open with questions, and then I'll make some closing remarks. Kimberly.
Governor, yesterday, the Department of Health Human Resources sent out a memo saying that two state employees have been confirmed with a COVID case. Can you share any more information regarding those two state employees, locations, what department they may be working at?
Yeah, I don't have I'm sure our Department of Human Resources has that information. I don't know specific information about those employees. I was most concerned about once I did hear that information, to make sure that we were rapidly deploying this plan that we have to get workers home. As I said, it went from 11,000 to 15,000, soon to be 19,000. But I don't have specific information on those two employees.
Just as a quick follow-up, since we're talking about testing and more people are getting tested, have you been tested for COVID-19?
I have not. I've had.
Is anyone in your administration and in
No, in my senior team, and there have been a couple of folks in the governor's office that have been tested because they knew someone who knew someone, and so we asked them to be tested, but we've had no positive tests in our office, and I have not personally been tested. I've had no symptoms.
Those tests are back, and they were negative. For those people you said tested in your office.
Yeah, that's right. Of the folks that we've asked to be tested, they have had a negative test.
And that's a couple, 2, 3, 4?
Yeah, I really don't know, and I'm trying not to. I'm trying not to tell them what it is that they do. That's, there's privacy associated with that. So, but we've told all of our, if they have a spouse that's sick, or to try and limit the exposure in our office, and people have been compliant to do so.
Earlier this week, I have 2 questions. Earlier this week, you said that the state would be using the $10 million that it's receiving from the federal government to award grants to childcare facilities. My first question is, will this money only go to existing childcare facilities, or could organizations such as the church use it to start a childcare?
The initial plan is that they will go to existing providers that are already being inspected and regulated by the state. That's our initial plan. We don't have any plans to fund organizations outside of currently licensed and managed childcare providers.
I'm talking about regulations. Would any regulation be relaxed during this emergency period? Could we be talking about relaxing the maximum capacity limit, or staffing, or health standards?
It's not any regulation being relaxed, but certain regulations have been relaxed. And we have asked folks, for example, we've asked folks to engage in their communities and offer to keep kids for their neighbor. So if you're keeping someone else's children as a part of child care efforts, we've asked that each one of those providers reach out to the Department of Human Services so that we know who is voluntarily providing child care, not in a child care facility setting, because we don't want to exceed maximum numbers, but there are a number of regulations that have been relaxed there with a real strong effort to maintain security and safety. For example, for every one of those who reach out to the Department of Human Services and indicate that they're willing to provide child care through volunteer services, they'll receive background checks. We want to make sure our kids are safe.
Governor, how far or how much exactly is your budget going to put into the healthcare safety net, and is that really going far enough? And are you giving any consideration at all to following, say, Florida and expanding Medicaid to meet the uninsured?
So we are, we're actually, the number, if I'm not mistaken, is triple the healthcare safety net number that we had in last year's budget. I'll confirm that number, triple the amount of increase that we put in last year's budget. It'll make it significantly the largest amount that we've had since that program started. But we're also communicating with the federal government on how we can use TennCare dollars to provide COVID services, COVID testing and healthcare. We already know we have testing available at no cost to everyone in our state, but to provide COVID health services and any services necessary associated with COVID sickness to those who are uninsured. We've talked to and are in conversations with CMS right now about the opportunity to explore that going forward. It would be targeted funds Medicaid funds used specifically for some portion of the uninsured population and specifically for health conditions related to COVID-19. So yeah, we are looking at that opportunity and we'll see where that goes in the future. Andy?
And how much money is that?
Oh, we don't know yet. We don't know yet because actuarially it's very difficult to determine how many of those uninsured might get sick and how many of them might actually require hospitalization. So it's possible that, we don't know what the numbers are for that. So we're actually working with CMS to try and develop some actuarial numbers around that so we know what the exposure to the state would be financially, but we're working hard to figure out a way to get that done, and we think we might be able to do that in the next few days, or at least have a strategy for it. Chris. Oh, I'm sorry. Yeah.
In lieu of GM's closing down for 2 weeks, at least 2 weeks, have you been talking to other companies, many of them recruited by the state of Tennessee, about what that possibility is and the effect it may cause?
The possibility,
I mean, are you talking to, I mean, the GM, we all know the GM ripple effect is huge.
right.
And are you worried about other companies? Many of them approved by the state of Tennessee.
Yep.
I mean, one's not approved. But
You know what, we're really concerned about the impacts that, that this is gonna have on our economy and on businesses. We are actually talking to other manufacturers about, plans that they may have to shut down if, this continues in the way that they think it's gonna continue, both small businesses and some larger ones. And certainly, the minute a manufacturer like GM closes, that does create a ripple effect, and we're in contact with some of those companies that are concerned about what that effect means for them. So that's part of why we are developing our budget in the way that we're developing it. It's why we are taking the steps that we're taking to prepare for an economy that none of us know what it holds. And yeah, we're concerned about that.
If I can follow up on that, on the rainy day budget, obviously there are some questions from lawmakers who say it's raining. And there are some, I think I heard bipartisan discussion about, you know, why can't some of the rainy day fund be used now? And I think I know the answer, but for others who, you know, have this question.
Yeah, the rainy day fund is, it's a reserve that will be used when it's absolutely needed. It's not absolutely needed right now. What is needed right now, we are setting aside funds for that. We put in place a $150 million coronavirus emergency fund. That's funding that might be needed right now. We have $1.3 billion in our state in our state unemployment insurance fund. Those dollars can be used right now. We have $750 million in our TANF reserve fund. They can be used right now. We have a lot of funds that we have put in place preparing for the day when we had an economic downturn, and those funds will be used right now. The reason that we want to put money in the rainy day fund is because there are economic downturns that, while this may not be one of them, there are economic downturns that last for years. And this state has a $38, $39, $40 billion budget, and a $1.5 billion rainy day fund is a substantial amount, and we feel very good about that. But we need to have that size of a rainy day fund when we have that size of a budget and the opportunity that we may have a downturn that lasts longer than any of us hope.
I got a question about ventilators. When I was talking to the department, they were saying they can be okay with ventilators. Where are some of these supplies going to go in the state? Are they going to the rural hospitals?
Dr. Pierce, do you want to answer that question?
Thank you for your question about ventilators. Before I answer it, let me clarify a little bit about what has happened today. As you can imagine, everybody in the nation is looking for ventilators right now to prepare for what might happen. I sincerely hope we never need to use one of them. But we have identified and ordered 570 today. I want to caution you that that doesn't mean we will have 570 in hand this week or next week. Because of the supply and the demand challenges that we're having, we do expect to have 80 or 100 or 150 in hand soon. To answer your question about where they're going to go, we're going to hold those centrally and which allows us to be able to look at need across the state and prioritize that. I'll reiterate, I hope we don't have to deploy any of those, but when we do, or if we do, we'll be able to do that where the need is.
Dr. Christie, follow up on that. That's 570 new ventilators. I don't know how many there are in the state right now. How many beds are
Those are both good questions, and those are both numbers that are tracked through our HERT system we talked about earlier this week, health resource or hospital resource tracking system. And so we're urging all of the hospitals to enter that information timely so we can keep an eye on that. Right now we have no bed capacity issues and no ventilator issues. But while we're talking about that, I want to take the opportunity to tell you what to expect or what we could expect over the coming days. I took a call from Vice President Pence for the state health officials at lunchtime today, and they are deploying rapid throughput rapid test throughout the nation. Here in Tennessee, we do not have a backlog of tests because we've been able to keep up with the demand, but other states have not had that luxury. So when this rapid throughput testing comes online in the next few days, I want everybody to be aware that we're going to see a big spike in the number of cases in the coming days. That's not cause to panic. That's not cause to rush out and get your own test. That is just representative of a backlog that's going to be testing. So please don't panic when you see this big spike of tests, because these are patients that are actually already starting to recover.
I just want to follow up, though. You said that you're asking hospitals to offer the information about the capacity for beds, but also ventilators. So is it safe to say you don't know how many the state has right now?
No, sir, we know exactly, and I can defer to either Dr. Dunn or Dr. Long. They have access to that HERT system on a daily basis.
I think it would be helpful to know that.
Sure, I'll defer to either of them.
Do you want to answer that question first?
I don't have the statistics in front of me, but we're tracking beds, both occupied and unoccupied, ventilators and ventilator use, personal protective equipment, supply, masks, gowns, et cetera, on a daily basis.
I guess just as a novice who doesn't know what 570 means, is that a lot? Is that a little? Does the state have 2 million of these that I don't know about?
Yeah, I don't have the ventilator number in front of me, but we can absolutely get that for you. I think, what we're preparing for is a worst case scenario. It's the scenario where we aren't successful in flattening the curve, and where we have a pronounced increase in demand all at once. It's what they saw in Washington. It's what we want to prevent here by the social distancing measures that we're putting in place. I think we have plenty of beds and plenty of ventilators for what we normally encounter here in Tennessee, but depending on how steep that curve is, we could need to deploy additional ventilators to our hospitals.
So some of those numbers about the supplies and ventilators and beds is available and inventoried routinely. The systems we're talking about are the systems that we use to monitor things in flux, and they're really tools to work between the Tennessee Hospital Association, the Tennessee Department of Health, so that we can do real-time monitoring. So the numbers change all the time, but what we want to be able to do with those numbers are identify where the needs are, and just in the simplest format. Actually, some of the systems we have actually have kind of a red, yellow, green type format where we can identify a need, or there's a concern, or we're good on that type of supply. So that's the way we use that tool or that set of tools to work between hospitals and the Department of Health.
And by the way, Joel, I think I know, I understand what you're asking for, and I think we can get that for you. Like, relatively, what is a lot of ventilators? And I don't know the answer to that question either, but we'll make sure that we want folks to generally know what is plenty. And the biggest challenge for that is that no one knows how many cases we might have. We can kind of look at Italy and see how much percentage of their population, but you actually really don't know globally who had the disease, because if they weren't tested, you don't really know whether they were, right? So it's very difficult to talk about what the need is going to be when there really is not enough data within only 6 months of a global pandemic to really know what might be coming our way. We certainly hope that all the efforts we're making will stem it, but I understand what your need is there, and I think we'll try to move toward relative information about the numbers of ventilators, for example, that we have. Sam?
Are you keeping the education savings account funding in next year's budget, and is it really essential?
We decided that we were going to keep certainly what's essential is that our children have access to high-quality education. Thousands of children will go from a poor-performing school to one of their parents' choice that will allow them, and these are low-income students, that will allow them to have access to high-quality education through the Education Savings Account program. It's already in place. It's underway. We are funding any program that we already have a financial commitment to fulfill. That includes that program or any number of educational programs that we think are going to be important. The education of our kids is crucial. And while we face uncertainties, one thing we're not going to be uncertain about is making sure that our education is funded fully, which is why we are continuing to provide for, albeit lessened, teacher pay raises, fully funding the BEP, and funding educational initiatives that we already had in place.
And let's do Andy into the phone.
Yeah, I've got a follow-up question. I'm thoroughly confused on the whole testing issue. So on the one hand, you're saying that you have adequate testing, but then you're saying you're going to have, with these additional tests, you expect a large rise in the number of reported cases. So tell me how is that happening?
Well, that's exactly.
If you've got sufficient testing now, why,
Well, that's exactly what you expect. So you would expect that if you have sufficient testing to test a lot of folks, and people present for testing, and you can get them tested, then they will more likely will have more people testing positive. If we had a limited number of tests, then we wouldn't have as much access for people to get tested, and we wouldn't have as many positives.
I get that, but I thought that there was some discussion about, I thought that you all had said that we had adequate tests, but then suddenly I'm hearing about pets talking, and there's all these new tests that are going to be coming in, and then it's going to rise. So tell me where I'm wrong. What am I missing there?
No, testing is rapidly increasing, right? So we're only testing a certain number of people a day in Tennessee, and as all of these testing capacity goes online, and states like us begin to have remote testing and testing in rural centers, and more people have access to being tested, I think you're going to see a climb in cases, and that's what we expect. And then we'll have a climb in the number of people that need to be treated. The alternative is for all these folks to get sick and no one's tested, which is a bad alternative.
Can you clarify about teacher pay raises?
We put in our budget a line item for teacher pay raises that was about half. I don't know exactly the number, but it's about half the amount that was originally proposed in the budget from February.
4% to 2%, is that correct?
From 4% to 2%. And I, something went through my mind. Chris, you may have asked it, and Kim, you may have asked it about people in the executive branch and in the governor's office having testing and whether or not we had confirmation about those being negative. I don't know specifically about who's been tested negative. I want to be real clear about that. We have had a couple people tested, and they have not tested positive, whether or not they're self-quarantined at home. So whether or not they've been tested as clarified as negative, we don't know. We don't know. Yeah. So I don't want to be unclear about that. We may have someone that tests positive, and but so to our knowledge, so far there's no one in our office and in the Capitol that has gone for a test and had a positive test.
At this point, we'll open it up to anybody on the phone. If you could please state your name and your outlet, and then the question for the governor.
Hey, Governor, it's Natalie. I have two questions, one of which is a follow-up on the question about testing. Do you think that you should require private labs to start releasing their negative testing numbers as a way to better understand the scope of the virus and testing on it?
Yeah, it's we don't require them to provide negative testing because it doesn't really give us much clear data. It's like bad data is not helpful, and we may have we don't know how many people out there in the state of Tennessee have the virus right now. So negative tests If 1,000 people went out there that didn't have, that wasn't presenting, or that was presenting mildly and got a negative test, it wouldn't be helpful for us to know that those 1,000 people got tested and they were negative. The only way that information is helpful for us to attack this disease is to know when someone tests positive, because that allows us to contact their contacts. It allows us to quarantine them. It allows us to start taking specific steps that will slow the spread. But knowing that 1,000 or 5,000 people have tested negative in a state with 6.7 million people is not particularly helpful. So, and it requires an additional step to provide that information. And those laboratories aren't usually used to that. They do tests all the time, and they only present data when they have a positive test. So that's what we're doing right now.
At this point, we'll take
And my other question is, can you I'm sorry?
No, go ahead. I'm sorry.
What was that?
Proceed,
Okay,
Natalie.
my other question was, can you elaborate a little bit on your talk with the federal government right now about using TennCare dollars to provide COVID services? Would that be for people who currently don't qualify for TennCare?
That's right. This would be for potentially a portion of the uninsured population that do not qualify for TennCare, but that the federal government would give us would allow us to use TennCare dollars for that population that don't qualify for TennCare because of this unique crisis that we find ourselves in. So it would be specific funding that is targeted at a specific population, and that population currently doesn't qualify for Medicaid.
All right, we'll take one more question and then we'll have
Kim?
we'll have to wrap this up.
Just curious for a follow-up on regarding your budget for the FMLA. Where is that right now?
That's not in the budget.
Okay, so that's what hopefully that'll be something that your administration will put back on the lawmakers.
Yeah, so none of our administrative bills that we were, we have some department bills that are qualified as administrative bills, but department bills that needed to be put in place to fulfill some requirement to continue operations. But none of the administrative bills that I brought forth to the legislature are being funded, except for the ones that are associated with tax revenues on internet sales. So
Okay, that's all the time that we have for this point.
I will be back tomorrow.
I just wanted to know, will the VSA program still, is it on schedule to continue or start next year?
It is. We're in the process now of securing enrollment for that plan, and we've not been very targeted on that in the last week or two, but yes, the goal is for that plan to go ahead and start this fall. Thank you all. We'll do that tomorrow.